This is Hwang. Nice to meet you. My name's Matthew. I'll be your therapist today. Have you ever been to PT before? Any experience?
I have not.
No. Have you ever, heard about it or have any preconceived connotations going into it?
Yeah, my friend had PT done before, but she said it was really painful, and I'm kind of worried that, I don't know, I'm going to get hurt even more, or like re-injure my thigh or something. I don't know. Yeah, so I was supposed to come in 2 weeks ago, but I just didn't feel like I was ready.
Yeah.
So,
Well,
but I'm here.
yeah, I mean, that's a totally valid concern.
Yeah.
Within any profession, there's good professionals and there's bad professionals, and the same thing in physical therapy. My goal is just to be the best physical therapist I can be for you. This is a collaboration. This by no means is a dictatorship. If something hurts, or if you don't feel right about doing something, we'll talk about it. We'll discuss it. And ultimately, if it's an absolute no from you, then we can always work around it.
Okay.
So since you didn't really have any prior experience with physical therapy, I'll go ahead and just explain to you what we're going to be doing today. So first, all I want to do is just get a little bit of information from you. Just get to know you a little bit better, and maybe what's going on here, so that we can specifically tailor a treatment plan for it. We got this interview, then we've got the physical exam component of it, and then maybe I'll give you some exercises to go home with. Does that sound good?
Okay.
Does that sound good?
Yeah.
Okay, good. Well, once again, I just want to thank you for coming in today and choosing us. Starting off, could you tell me a little bit about when you were born?
I was born October 9th, 1994. So I'm 24.
24?
Yeah.
Okay, nice. Now, as far as your job, what kind of activities does your job entail?
I am a dancer at SeaWorld. I am the people that wears the costumes.
Yeah.
So, I pretty much, I'm walking a lot, I'm dancing a lot, just on my feet like all the time.
Yeah. So, and how often would you say you're on your feet throughout the day?
Majority of the day, so I work like 60 hours or so a week.
Hard worker.
Yeah.
And when you're dancing specifically, is it more running and cutting, or is it more just like more fluid motions? Or how would you describe your dancing style?
So it's more like, I'll take some like grapevine steps, or like I'll spin a little, like run across the stage and stuff, but nothing like leaps or anything.
Okay.
Yeah.
Okay. Now, are there any specific components of your dancing or your job that you can't do now because you got trained?
Yeah, my dancing.
Oh, all of it?
Just all of it. Like I'll kind of push through it, but like I'm in so much pain.
Oh, jeez.
Yeah.
Okay. We definitely don't want that. Let's see. But when you're not at work, what do you like to do outside of work?
I like to get some drinks with my friends for happy hour. Yeah.
That's good. Yeah. You got to unwind somehow.
Yeah.
Now, as far as when you're not at work, when you're not hanging out with your friends, what do you do for exercise?
So I started this like running schedule for myself like 8 months ago.
Mm-hmm.
Pretty consistent. I just wanted to lose some weight, so I was like pretty with my schedule. So yeah.
Is that something after we get things completely resolved here? Is that something you want to go back to right away?
Yeah. I like that.
Excellent. Any barriers you see for yourself that might prevent that?
I'm just worried like maybe I might get hurt again or something, but I guess I'll just figure it out when it comes down to that.
Yeah, that's okay. Hopefully, by the time we get to the end of this process, we'll have a clearer picture. But not knowing is perfectly fine for right now. We're just trying to get you better. Let's see. So, what's your living situation like? Where you live?
I live in a 1-floor home with my dog. It's just me and my dog. Nothing to it.
What kind of dog is it?
She's half Pomeranian, half something else.
So lots of energy.
Yes, lots of energy.
Do you have any sort of stairs, or I guess what I'm asking is, do you have anything in your environment that sort of causes those symptoms to pop up?
No stairs, but I just walking from room to room hurts me if I'm like on my feet for too long.
Got it. Now I see you've got your crutches right there. Did your doctor give you those crutches?
Yeah, it gave it to me right after the incident happened.
Okay, excellent. And did your doctor show you how to use this?
Yes, he did.
Excellent. Would you mind showing me, how you use those
I can
crutches?
show you later.
Well, that pretty much, covers everything as far as what you're doing day to day. Is there anything else you want to tell me about as far as how you interact with the community or?
No, I mean I mostly just go to work, come home. That's it.
And unfortunately, you got this leg thing going on.
Yeah.
Well, about that, your doctor referred. I saw your doctor. That's what your doctor referred you to me for. Could you describe what's going on with you?
Yeah, I mean I just hurt in the back of my thigh here, so I've just been in a lot of pain.
Would you mind showing me where?
Yeah, it's just like right here.
Okay.
Yeah.
If I were to where on my leg would you? If I'm like, does it start like right here? Like where just like move my hand? Like where does it start with my hand?
So from right here to like here.
Got it. So
Yeah.
it's like right above your knee.
Yeah.
And so like maybe like starts like in the glute region.
Just like right below it.
Okay. Now this pain, does it feel like deeper into your leg, or is it more towards the surface?
More deep.
More deep.
Yeah.
Okay. Does it move around at all, or is it just pretty much there
It's
right
just
there?
that area.
Okay.
Yeah.
Excellent. Now could you describe your pain a little bit for me?
Yeah, it's like a deep, achy, sore feeling. Like my muscles are being kind of pulled a little bit.
Okay.
Yeah.
Okay. So no shooting pain, just
No.
achy.
Yeah.
Okay. Excellent. And then as far as how intense it is, on a scale of 0 to 10, 0 being you're in no pain, you're doing just fine, you need to be here right now, and then 10 being emergency room, this is the worst pain of my life. How does it feel right now just sitting here?
Just sitting here, 1.
Excellent. And then as worst, how would you say?
A 6.
6, okay. And then at its best, how would you say?
0.
Just overall, do you have any numbness or tingling?
No.
Excellent. And then overall, how would you say that you perceive your pain?
It sucks. I
Yeah.
just don't want to be in pain anymore. Yeah.
Is there any specific way like it feels to you, or like is there any more like descriptors that you provide, like how you perceive it, or like when it's happening? How it feels to you?
I mean, yeah, it just feels like I can't really move it as much as I would like to. Like it just feels like every time I take a step or do something, it just like pulls more.
Oh, jeez.
Yeah.
Well, so like specifically, what do you? Sorry, I actually. Is there anything? So you've got the pain going on your leg. Is there any pain in the rest of your thigh?
No.
Is there any pain in your shin?
No.
In your foot?
No.
In your hip? How about anywhere on your other leg?
No.
In your hip?
No.
Abdomen? Chest? Anywhere in your back?
No.
Your neck?
Nope.
Head?
No.
How about your arms?
No.
Excellent. If I go ahead and show you this body chart based off of your complete description of your pain and everything, does this look accurate to you?
Yeah.
Excellent. Awesome. Now, as far as what tends to aggravate these symptoms, are there any motions that aggravate, or are there multiple motions or multiple things that you do that aggravate it?
Yeah, I think like walking for sure, and dancing. Yeah. Those are like the 2 big things.
Okay. Now, when you're walking, how long does it take before the symptoms start to present?
More than 2 minutes. I'll start feeling it.
1 to 2 minutes. And if we use that same scale from earlier, 0 to 10, how would you say it feels on the scale?
Like a 4 going to 6.
Oh, okay.
Yeah.
And then as far as dancing goes, about this 4 to 6 on
Yeah.
that scale.
Mm-hmm.
Okay. let's see. And then how long before those symptoms start to present when you're dancing?
Yeah, it depends on the movement. So like 5 to 10 seconds.
What's the dance or the movement that usually produces it?
Just any type of like lunge or stride that I have to take.
Produces it right away.
Yeah, because it's like depends on the beat and the move speed of it.
And then when it gets produced right away, what's the scale on that?
Like a 6.
Okay,
yeah.
And then for your walking, how long does it take for it to go away?
To go away, maybe around like 10 minutes. Yeah.
And then for your dancing, how long does it take for it to go away?
Like 20 or so.
So it's a little longer, right? Now, as far as what you do naturally to sort of like make it feel better, what are some easy things that you do?
I rest it, and I do the rice thing. My doctor told me to do those too. So, yeah.
And that seems to work.
Yeah.
As far as throughout the day, in the morning, how does your leg feel?
It's a little stiff, but other than that, it's okay.
On that same scale, 0 to 10, how would you rate it in the morning?
Maybe like a 1. Yeah.
And then when it's stiff, how long before that stiffness tends to go away for you?
Maybe like a minute or 2. Yeah, it's not too bad.
Now, like throughout the day, if we use that same scale, how does it feel
Throughout the day, it feels, like a 2 or 3, goes up to a 6. Yeah.
And then
At night, once I'm able to rest, it feels a lot better. So like closer to the 0.
Closer to the 0.
Yeah.
Excellent. Now, just looking at that amount of form that you filled out here, I see that you did check that you have a little bit of anxiety. Would you be comfortable talking about that or not?
Yeah, I don't mind. I just don't really know what's going to happen, and I'm kind of worried I'm not going to be able to dance again. I'm going to lose my job, and just kind of this cascade of events that might happen because I just injured myself. So it's been kind of like heavy on my chest and just kind of like freaking out, like what's going to happen. But it's okay. I'm like working on it. It's fine. Yeah.
Those are all completely valid concerns. It's as adults, I think I just have those things you mentioned. I definitely understand it. I can relate to. Some days I'm like, how the heck? But I ask that because I want to know whatever's going on at that time. If you want to talk about anything, please feel free to mention it. Let's see. It also says that you have a past history of trauma. Is there anything going on with that?
Yeah. I injured myself when I was in high school doing cheerleading, and I got hip surgery for it. So, but I'm okay now with it.
And then anything you want to mention as far as family medical history or?
No.
Excellent. Do you have any sort of pain, completely unprovoked pain that just wakes you up in the middle of the night?
No.
Any unexplained weight loss?
No.
How about imaging? What kind of have you taken any imaging on your leg?
Yeah, we did an MRI and an X-ray, and the doctor said I had like a grade 2 hamstring, which made me freak out even more. But yeah, that's what I got.
It sounds a lot scarier. Now, are you taking any medications?
Yeah, I'm taking Mobic.
Now, I know it also says that you learn best by doing on here. Is that still correct?
Yes.
You like me to demonstrate the exercises?
Yes.
Excellent. And then would you say, are there any barriers to learning?
Or? Just worried that I might get hurt again, but I think it's okay. I'll be fine.
Now, what caused the pain as far as?
I was trying to put up some flowers, and I kind of lost my balance on this pot, and then my dog was right there, and I didn't want to step on her, and I was like, what are you doing? So I kind of tried to avoid her and landed funny, and I just felt it.
It's pretty sudden.
Yeah.
Have you had any previous history?
Nope.
Excellent. And then do you have any goals that you'd like to get at?
Just getting back to dancing, walking, no pain, so, yeah.
Well, that concludes this portion of the interview.
Okay.
We're going to move to the physical therapy now.
Okay, great.